Good evening, everyone. This session is being recorded. Welcome to the second of a six-part series, Picking Up the Pieces, Healing Our Community. Tonight's session is called Rona. Is that you? Protect me. Our moderator is Dr. Faith Fitzgerald. Dr. Fitzgerald?
Good evening, everyone, and thank you for attending our session. At this time, I'm going to start with our presentation. Rona, is that you? Protect me. I'd like to begin by introducing our presenters for the evening. There are some dynamic women of color, and we are blessed to have them in attendance tonight. Our first presenter is Melody Armstrong. She served in the United States Navy for 10 years in the enlisted ranks as a hospital corpsman, both stateside and abroad, in a myriad of capacities, inclusive of Operation Desert Storm, Desert Shield, and the Haitian crisis in Guantanamo Bay, Cuba. She is a proud 1997 graduate and military alumni of Norfolk State University's second-degree Bachelor of Science in Nursing program and was commissioned as a U.S. Naval Nurse Corps officer. She was the first Navy Nurse Corps officer to earn the Surface Warfare Medical Department Officer Pin and the first female African-American Nurse Corps officer to serve on board the U.S.E IWO JIMA. In 2007, Mrs. Armstrong retired from active duty after over 20 years of service. Thank you for your service. Currently pursuing a PhD in nursing education, she serves as chair of the Advisory Council on Health Disparity and Health Equity in Richmond, Virginia, and is a member of the Virginia Medical Reserve Corps. Mrs. Armstrong also volunteers assistance to the Virginia Department of Health, particularly in the city of Norfolk. She is a faculty member in the Department of Nursing and Allied Health here at NSU and serves on the NSU Center for Excellence in Health Disparities on the steering committee. Her words to live by are, I can truly say that I've been blessed. If I can help someone as I pass along this way, then my living won't be in vain. Our next presenter is Sable K. Nelson Dyer. Sable K. Nelson Dyer is a licensed attorney and public health policy expert, specializing in research, communications, and training in healthcare policy and legal analysis. She is a graduate of the HBCU, North Carolina Central University Law School, and holds a Bachelor of Arts degree in both political science and biology from the real HU, Howard University. Sable K. Nelson Dyer is currently the Acting Office Director for the Virginia Department of Health, Office of Health Equity. She holds the role of the Virginia Department of Health representative on the Health Equity Leadership Task Force for the Health Equity Working Group during the COVID-19 response. Sable K. remains engaged in local, state, and federal HIV, AIDS, STI, and reproductive justice advocacy campaigns, base building, training, and educational initiatives, as well as technical capacity building assistance. She is an active member of the Delta Sigma Theta Sorority Incorporated, as well as the NAACP National Board of Directors, with a devotion to social justice issues and a passion for politics. In her limited downtime, and I mean limited, girl is working, Sable enjoys cooking, knitting, playing with her dog, and watching historical dramas. Our next guest is Dr. Erica Steele, DNM, ND, CFMP, BCND, a child of two Marines, love the military background, now practicing in Virginia Beach, Virginia. Dr. Erica Steele is the founder of Holistic Family Practice, where she specializes in natural health, healing, disease prevention, and holistic health care. As a highly educated, multi-degreed, and extensively trained board-certified naturopathic doctor, a doctor of natural medicine, a certified functional medicine practitioner, and a certified homeoprophylaxis practitioner, Dr. Steele uses multifaceted and synergistic approaches to physical, environmental, mental, emotional, spiritual health. Her work often supplements or co-manages that of her patients' general physicians, surgeons, nutritionists, therapists, and other healthcare providers. Whomever you have helping you, Dr. Steele can assist them too. Since 2001, she has helped transform the lives of over 30,000 people. Having been immersed in her own family's world of medicine, health, and holistic healing since early childhood, Dr. Steele prides herself on practicing safe, effective methodology within the realms of proven science. Dr. Steele has an associate's degree in psychology, a bachelor's degree in natural medicine, a bachelor's degree in natural healthcare sciences, a doctorate in natural medicine, a doctorate in naturopathy, a master's in public health with an emphasis in CAM, and hundreds of certifications in various natural healthcare modalities. Dr. Steele has made television and podcast appearances, notably WTKR in the Hampton Roads area, a dynamic group of women. So we're going to get started now with our presentation, and it's Rona, is that you? Protect me. We'll start with, Rona is known as two different things as well. SARS-CoV-2, which is severe acute respiratory syndrome, coronavirus 2, which also leads to the disease coronavirus 2019, better known as COVID-19. So as we talk about the virus, there are some symptoms that are very common to the virus. You can see on the screen the list of common symptoms: fever, fatigue, respiratory symptoms, uncommon symptoms, which are things that happen but not as regular as common symptoms: headache, loss of taste, smell, nasal congestion, sore throat, and a productive cough. More severe symptoms are experienced by some. Most people have common symptoms, but severe symptoms are high fever, coughing up blood, decreased white blood cells, organ failure, coma, and we know that some people, unfortunately, have died from the disease as well. So when we talk about health disparities and COVID-19, a lot of folks talk about testing and the United States having a large number of folks who are impacted by COVID. 22% of the US population has been tested, and we have tested more people than other countries worldwide. Most of the deaths from COVID have come from the US, Brazil, Mexico, and India. Vaccine trials are underway, but right now there's no known antiviral treatment for COVID at this time. What we do know and have heard is that COVID-19 disproportionately affects racial and ethnic minority groups. So with that in mind, I'd like to begin asking questions of the panel. There will be a question and answer period for the audience after the session ends. What we want to do now, though, before we get started on the questions, is ask a couple of poll questions. So Ms. Alexander, could you pose the poll questions to the group, please?
Yes, I can, and if you don't mind, I'm going to start out with one just to get an idea of who we have with us today. Yes. Okay. So we're going to give it just a few seconds to find out who we have with us today. Okay, we're up to 59% of our people that have voted. Let's wait for a couple more to get in. Okay, we're going to end it here. We're at about 73% of our folks.
Okay, we'll start with our first question. It's for our guest presenter, Ms. Nelson. Racial and ethnic minorities are reportedly disproportionately affected by COVID-19. Should African Americans and other minorities be among the first group to sign up for a vaccine once it becomes available? Would you tell us why or why not?
Absolutely, and good evening, everyone. It is such a pleasure to be with you all this evening, especially big thanks to Dr. Armstrong and Dr. Burwell. I'm so happy to be here and answer your questions about COVID-19 tonight. And to specifically respond to your first question, my answer is a reserved yes. I certainly understand, as you all can see, I'm an African American woman, and I know our history. I know the challenges that we've had in the way that our bodies have been misused and abused by the medical system. But at the same time, as a person who's working in public health and who understands a little bit about pharmacogenetics, I just want to make sure that we are positioning ourselves so that the vaccine that works for our bodies. And what I'm really concerned about is not having, yes, I think that Black people and Black folks should be in line to get the vaccine when it comes out. I think that we should read. I think that we should not walk into that recommendation blindly. I think that there's going to be plenty of information out once the product has been reviewed and vetted and tested. I think it'll be incredibly important. One of the committees that I sit on for the Virginia Department of Health is working on vaccine messaging so that we can communicate with the community as the different products are developed, letting them know how to go about what would make the most sense, and have given the information for individuals to make the most informed decision. But long story short, the answer is yes, because it's going to be important for us to have the vaccine. We should do what we can to promote and protect public health, but at the same time, we have to be smart about how we do it and make sure that we inform ourselves before so that we can make the most informed decision before we inject ourselves with the vaccine when it becomes available. And side caveat to that, I also would like to encourage African Americans to participate in vaccine trials. There are several safeguards that are in place to prevent some of the misuse and abuse that Black folks have experienced in the past, and it'll provide good data on the back end that will help us, again, to make that informed decision when that moment comes.
Thank you. There were some poll questions presented. Ms. Alexander, can you put those back up? Okay, so if you all can see, wow. All right, thank you. Panelists, are you all able to see the information shared from the poll? Okay, great. Okay, thank you so much. Okay, our next question is kind of in line with that. So the next question for you, Ms. Armstrong, is what is being done by the Commonwealth of Virginia to educate minorities on ways to prevent the spread of COVID-19?
First of all, I'd like to say good evening to everyone. I'm deeply humbled to be sitting amongst these great giants among us tonight of women, African-American women. And I think that we all have a shared vision or a common purpose and working together towards a common purpose. As far as the state of Virginia and how we are progressively moving forward, as far as educating the community regarding COVID-19, there are many, many initiatives that have been in place and are continuing to be in place as far as specific task force that have been set up by Governor Northam. Here in the local area, we have our ministers of our different faith backgrounds who are banding together to put the word out, because we know from a cultural perspective that even though African Americans may not listen to even doctors and nurses and licensed professionals, they do value the sense of their religious leaders and their religious faith, and faith and spirituality plays a big role regarding healthcare choices. And so they have actually come together and made a video for the local area here in Norfolk, being tested as well. So I think that there are definitely pace setters among the African-American population as well with that regard. As far as education, we have all kinds of education that is being put out in hard copy, as well as what I like to think of as ambassadors in the communities, because we know that trust and mistrust, more so, has been a caveat among the African American community when it comes to health and wellness, and receiving the same standard of care has even been a question and a concern in the African American community. And so that's, even though that might seem so far back as Tuskegee, there's still some concern with that even today. And so we know that community leaders and ambassadors and advocates are out there on these different task force in the community, putting out that information. So more so than just what you see on TV per se, when Governor Northam is putting out information, or Dr. Oliver, our Virginia State Health Commissioner, but in those local communities, when you see someone that looks like you, who's lived where you've lived at, and to some degree have experienced the lived experiences that you've lived, then the research shows us that there's a trust factor that lends to that information that's being put out.
Thank you for that. And I will say that what Sable Nelson shared about more minorities needing to take place, participating in clinical trials, and to consider reading and gaining knowledge, and then participating in the vaccine once it comes out. Are there specific efforts being made to target pastors and minority support groups to educate them on what's being done differently, so that they don't have to fear what happened in Tuskegee will happen in America now?
I can speak to that a bit. We've been doing some really incredible work. I've had the honor and pleasure of serving as chair of our Health Equity Working Group, which is a public-private partnership between our state agencies and our several different community partners from across the Commonwealth. And we are leveraging the strength and the insight of that brain trust to develop messages, and also to create and encourage messengers to deliver information that would be impactful for community, specifically through the great work that Veronica Cosby is doing through our Partners in Prayer and Prevention program, is really working with our communities of faith and its diversity, whether it's of the Christian faith, or it's individuals who are Jewish or practicing Islam, but it's really looking at individuals from a variety of worship experiences and looking to them, those faith leaders, to lead their flocks and provide information, because we know that sometimes the public health department isn't the most trusted resource. So we want to make sure that those individuals who are those key opinion leaders and trusted opinion leaders have the information that they need, and we are looping them into conversations about vaccine development and other messaging components as it relates to COVID-19 activities.
Thank you. Thank you. Okay, so 2020 has been quite a year of so many challenges, particularly for communities of color. Stress and COVID are major issues affecting us, as well as Black Lives Matter, police brutality, unemployment. You got the African bees, and then an election in the midst of all of this. And so with that in mind, I'd like to know from Dr. Steele, we're dealing with a lot in 2020. Can stress impact our chances of getting COVID-19 because of how our bodies, stress impacts our body?
Hi, so thank you guys for having me. I appreciate it, and I appreciate being able to provide a different perspective. So stress is like gasoline on a fire, okay? So if you already have a fire brewing and you throw stress on top of it, it's really just going to ignite what's already there. I think it's important to know that disease doesn't just happen. I think we like to take this very victim stance that our bodies are totally innocent and perfect, and then all of a sudden something happens to it. And I think we need to shift into more of a personal responsibility perspective, where I personally, individually take responsibility for my health. So what does that mean? What does that look like? That means I'm being mindful of my prayer, my meditation, my spiritual practice. I'm being mindful of the water that I'm drinking, the food that I'm putting into my mouth, how I manage my stress. Am I working out, right? Am I structuring my life, my schedule? Am I creating healthier boundaries, etc.? It's never one thing that creates disease. It's always a combination of things, of factors. And any given moment, you're either building health or building disease. And I think it's just a matter of what you're wanting to choose in any given period of time. I think now more than ever, we have great impacts on our genetics, especially within the African American, Jewish, and Native American ancestry specifically. We have a lot of trauma that's been recorded in our DNA that has proliferated and made a lot of instabilities, specifically around the neurotransmitters in the brain. And so we really need to be very mindful and very judicious of how we handle things. That has also impacted our mental health in general within the Black community. And so we really need to be proactive with all of this and not just wait around for this or that or someone else to save us or fix it or whatever. We each individually need to take personal responsibility for our health. And then, you know, we'll see success.
Thank you. I appreciate it.
Yeah, of course.
Okay, and so as of September 5th, there were more than 6 million cases of COVID-19 in the United States and close to 190,000 deaths. Ms. Armstrong, if a person has been diagnosed with the virus, when should they go to the hospital? What type of symptoms should they be looking for as serious enough to go to the hospital?
Thank you for that question. First of all, I would like to say, particularly in the African American community, that's very objective, or very, I should say, subjective. Illness, the continuum of illness and wellness, and what one perceives as, per se, being ill enough to go to the hospital. And there's a lot of variances as to why many people in the African American community do not choose to go to our traditional hospital setting to, you know, seek care. And oftentimes that leads us to delayed care, which can lead to less than optimal outcomes, patient outcomes. So I would say that anytime a client feels or a patient feels as though they are symptomatic, meaning they are having, you know, coughing, high temperatures that are not resolving with, say, even over-the-counter medication, because a lot of these symptoms that go along with COVID can also be misconstrued with other disease processes. And particularly with the flu season coming into, you know, here very shortly, that's a major, major concern, as the symptoms may appear to be somewhat a crossover or interconnected. And so I always am from the perspective, it's better to go and it be nothing than to not go and delay care. And then, you know, it's so far into the disease process that it may require you to actually be admitted to the hospital versus self-quarantine, say, in the home environment.
Thank you. Ms. Nelson, do you see the number of people infected decreasing or increasing in Virginia over the next few weeks?
The good news is that over on the Virginia Department of Health website, we have a 7-day average that you can see from our very first case back in March, and you can track the number of positive cases that we've had to date. And the good news is that over the last 7 days, excuse me, and actually when you look over the last 14, over the last 2 weeks, we've been on a downward trend statewide. Of course, there are a couple of areas that are having some upticks right now, but overall as a state, we've been going down. I must say, as Dr. Armstrong alluded to a few moments ago, this is possibly the calm before the storm. We're preparing for the flu season, so people are spending more time outdoors, but we know that as it gets cooler, people will be spending more time indoors. So we're just going to continue to monitor those situations. We have been doing a lot of planning. The VDH team and our community partners have been working tirelessly to develop plans and to put some infrastructure in place to mitigate the impact of COVID-19 in the fall. But just being as honest as I can and as transparent as I can, we are anticipating that there will be an increase in the fall.
And I liked what Dr. Steele said, you're either building health or building disease. I think that I'm going to keep that in mind over the next few weeks when it comes to the flu and everything else. Okay, thank you, ladies. I appreciate that. Okay, ways that we can prevent the spread. We've all heard of these ways. We're going to talk about some alternatives to that. Clean your hands often with soap and water for 20 seconds. Some people sing the happy birthday song, or hand sanitizer that contains at least 60% alcohol. Avoid close contact with people who are sick, obviously exhibiting signs because we're not psychic. Put distance between yourself and other people of at least 6 feet. Cover your mouth and your nose with a mask when around others. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently. Touch objects and surfaces daily. And then masks may help prevent people who have COVID-19 from spreading the virus to others. So those are some ways we can help prevent the spread. So now let's talk about some other ways we can protect ourselves and talk about testing and treatment as well. So the first question is for Ms. Nelson. What kind of tests are there for COVID-19 and which is the most effective?
So there are 2 different types of tests that are available. One type of test is a viral test and the other type of test is an antibody test. I wouldn't necessarily say one test is better than the other, but it is important to know that these tests give you different information. So a viral test tells you if you are currently infected with COVID-19 versus an antibody test tells you if you might have had a past infection. So you're just going to want to think about where you are in terms of how you're feeling and speak with your medical provider in terms of what test would be best for you. In terms of answering the part of the question about which test is best for COVID-19, I know that there are a lot of different producers and companies that are involved in making tests, and there are rapid tests that are now under development and being solicited. I know that our Commonwealth entered into a multi-state pact for rapid testing. So I'm not going to get into the weeds about which brand's test is best, but just wanting to keep in mind that you want to be tested for what you're looking for. So if you think you might have a current infection, request a viral test. If you're trying to see if you used to have an infection, if you were sick in the past, use an antibody test.
And so I know that when COVID-19 first came out, the internet was full of ways that you can cure it, prevent it, all kinds of different things. And I'll be honest, I was one of those people who tried some of everything, just trying to fool myself that that was going to keep me and my family safe. So Dr. Steele, can you answer, is it true that standing over a pot of steaming water with lemons or oranges, onions, people have used some of everything, and salt, does that cure COVID-19?
You know, I really can't even keep up with the amount of folklore out there. And I think a placebo works for, you know, however many people the placebo works for, right? I am a woman of science. One of the things that I really wanted to do was build legitimacy in holistic healthcare. And the way that we do that is to ensure that things are scientifically proven and validated, et cetera, right? You know, otherwise we get into the, you know, the quackery kind of world, and I like to not be in that world. So I think it's important to go with what we know, right? Like we're a long way off from long-term studies in terms of what works, what doesn't work, especially in the natural healthcare realm. I mean, you know, geez, we're a little bit, you know, we're coming out of the dark ages. So to say that this does that, that's very premature. Here's what I can say, right? There are things that help stabilize the immune system. I notice you have the word boost on there. We don't want to boost the immune system, and here's why. The amount of toxicity within our environment today actually is overworking most people's immune systems, okay? And that's what's creating and generating autoimmune conditions, right? So we don't want to be boosting anything. We want to balance. That's what we wanted. In biochemistry, we're always balancing things, right? This number is high, we want to bring it low. This number's low, we want to bring it high. We want to balance it, right? So some of the things that we can do to balance our immune system if we're concerned about it, number one is our food, what we're eating, right? Avoiding sugar, right? Alcohol classifies. Bread, pasta, rice, those things are converted into sugar, simple carbohydrates, potatoes that I'm sure a lot of people love. Those are all things that are going to generate and weaken the immune system, right? So then we look at, okay, these are the things I'm going to eliminate out of my diet because those are going to inhibit my immune system, right? Now I can work on stabilization of my immune system. What are some things that stabilize my immune system nutritionally? High dose zinc, high dose vitamin C, high dose, actually elderberry and licorice root and garlic are expectorants as well. Very helpful for the lungs. If there are any weaknesses in the lungs, right? If you're a smoker, that's a real challenge with this particular condition because it does affect and attack the respiratory and cardiovascular system. So quitting smoking is absolutely very, very important. On more of a holistic end, dealing with grief and things like that, because that will inhibit that meridian system. That's more Eastern, not Western medicine, right? So there are a lot of things to do, right? And so I'm a very specific supplementer, meaning that I'm going to look at a patient's lab work and then make a determination based off of the lab work. I'm not just kind of pulling something off the shelf and taking it. And in fact, you can do a lot of damage doing that, right? I had a patient, unfortunately, just come into my office yesterday, and he was prescribed a lot of psychotropic medications. He was taking himself on and off of them, also taking St. John's wort. Big no. Now his magnesium is plummeted, right? Because he didn't realize that St. John's wort was an interaction between that particular pharmaceutical drug. So you have to be very, very careful. There are interactions between pharmaceutical medications and nutraceuticals or supplements or whatever. They're nutraceuticals in our world, different than pharmaceutical because they're pharmaceutical grade supplements. But, there are a reason why doctors like me exist. There's a reason why I went to school forever and I have a ton of student loan debt. It's because I wanted to ensure that I did no harm with people. There's a lot of nuance and biochemical information that you want to be aware of. And that's one of the challenges that we have right now in holistic healthcare. Sorry, I live at the ocean front, so there's like a bajillion planes. So one of the challenges we have is people believe just because it's natural that it's safe. And so they'll Google something, and because an influencer or a blogger or somebody says something, right? And I tell people, doctors like me, we're bought and sold every day. Just because there's a doctor that's on, a blog or something that says this supplement is going to, cure you, does not mean that it's going to. And most often than not, it's not, because when things are too good to be true, they typically are. So I would just really focus on the diet and nutrient stabilization primarily. And then there's other things that you can do, but really that's more of an individual case by case basis. But to say something cures something, legally, we can't even say that. I'm sure your attorney would say that. And, we can support the body's ability to heal itself. We can, prevent things, but curing things without a scientific, double-blind, peer-reviewed, clinical-based study, forget it.
All right, thank you. That was good information. Ms. Armstrong, do you have any home remedies or natural medicines that folks can take to help treat COVID-19? This question is for you and Dr. Steele.
From my perspective, absolutely not. No home remedies, but I will say that I do envision home remedies to a certain degree as being compliant with things like wearing your mask. Those are things that you can do, right? Good hand washing, making sure that you are not putting oneself in increased risk as far as like large crowd. Those are all things that we can do that really don't cost anything, but other than being compliant, as far as paying attention and adhering to those guidelines. And hand washing, I remember back even in nursing school, it was taught to us as being one of the biggest things that we can do to decrease the risk for acquiring infection, germs, and all of those things. So I would say, bring it back to the basics. Sometimes we think that we have to spend $1 million to get $1 million, answer or cure, when really it's the basic things that will keep us safe.
Okay, and I have one more question and we're going to open it up. I see we have some questions in the chat. Dr. Steele, so is it true? There's a video on the internet with a nurse with her back turned, and there's another nurse behind her, and she's patting her down her back and saying that this breaks up the mucus in your lungs. And so if you are suffering, if your lungs are suffering and you have pneumonia, that this is to help relieve it and will prevent you from having to go to the hospital due to COVID. Can you share, give some insight on that?
Yeah, so, I get a little frustrated, I think, at times where people take one thing and they like blow it to this extreme. I think as a culture, we want the quick fix and we want the magic pill, or we want the magic this. There is no magic pill on the face of this planet, not even a pharmaceutical drug, right? And again, like I said, you're either any given moment, it's about balances. So any given moment you're building health or building disease, right? So cupping is actually very helpful for the lungs. We use it a lot to break lung fluid up. To go to the extent of saying that now it can cure pneumonia in the lungs, which that's a viral infection. Okay, no amount of cupping that I'm gonna do is gonna do anything for a virus. So I think that's, I want people to feel empowered, right? And that's my job as a public health educator, is to empower people. Like, I appreciate the structure and, be compliant, but I will say this modern day generation is not necessarily the most compliant of folk. Just throwing that out there. And so I think what they're looking for, and what they're searching, Google searching, right, is what can I do? I feel powerless. I feel afraid. I'm washing my hands. I'm doing all this kind of stuff, but what else can I do, right? In the grand scheme of things, cupping would not be my go-to. I can't even think of a time I've recommended that to somebody. Maybe, I don't know, several years ago. Really, high-grade nutritional support if and when your diet is not going to be sufficient, right? So organic whenever possible, lots of fruits and vegetables, minimizing sugars, things like that, simple carbohydrates, and then building those supports there. Like one of the symptoms of COVID is loss of taste and smell. That's zinc. That is a zinc deficiency, right? So you can get ahead of that by stabilizing zinc within the body. Zinc is, so many chemical processes in the body zinc is responsible for, right? High dose vitamin C, we're talking 4,000 milligram vitamin C, right? You can do 2,000 milligram, maybe a BID, but, the thing is that, there are things that you can do, but again, this is why professionals exist. I think there is a convergence where, yes, you want to be empowered, but Googling something, I remember when I first started in practice, Dr. Oz started. Oh my gosh, and me and Dr. Oz, like, ugh. And I remember somebody saying like, well, Dr. Oz said, I was really upset. I was like, well, go get an appointment with Dr. Oz then, right? And the reason I said that is because, I love Dr. Oz, by the way, but the reason I said that is because, the internet doesn't have your H&P. They don't have your health and physical. They don't have your lab work. They don't have any information on you as the individual person, right? And so what you're doing is you're going online, you're picking up one or two things, you're throwing paint up against a wall and praying that it's going to work. And that's just not how healthcare or science works. You know, Ms. Armstrong talked about, or Dr. Armstrong talked about subjective. There's objective analysis, a laboratory outside of me and you that we can measure data to be able to assess if a protocol is effective or not. That's what we want to do. Not just like take a little bit of this or take a little bit of that. I mean, you know, I think they were burning people at a certain point for that. So anyway.
Right, thank you for that. So we're going to take some questions from the chat. Any one of you or all of you can respond. The first question is, why is COVID-19 impacting the Black community so viciously?
I can start. One of the reasons why, COVID-19 is impacting the Black community is a complicated, but also not so complicated one. It's one of the things that has been illuminating for some, but had just been the lived experience, I'm sure, of many of the individuals who are on this video meeting tonight, is that COVID-19 has exacerbated, like made worse, the inequalities that currently have been perpetuated in our healthcare system, but also in our lived experiences as Virginians, as Americans. We know that some of the factors that contribute to increased risk deal with discrimination and the things that are related to systemic racism and oppression that has been baked into our everyday processes, our education system, our ability to obtain wealth, and all of those components that impact our ability to access healthcare and to utilize healthcare. Also, we know that Black folks are, by the nature of our occupations, are more likely to be in those critical infrastructure positions where they are more likely to come into contact with other individuals. They may not be able to telework, and so they would be more likely to have opportunities to get the virus that way. There are also issues and concerns as it relates to housing. A lot of Black and brown folks live in intergenerational households and live in households where the number of bedrooms outnumber the number of people outnumber their number of bedrooms that are there. And so it creates a situation where, to the extent there needed to be social distancing or physical distancing, to the extent that someone did need to quarantine at home, the whole household would be at risk just because of the nature of our living situations. So it's a complicated situation, it's a complicated answer, but it's one that's going to take individual approach, but also a whole of government, a whole of community approach to dismantle the systems that have allowed these inequities to exist and persist, both during this time and in the past.
Okay, awesome. Okay, the next question, thank you, Alita, for that question. The next question is from Ms. Jones. Once the vaccine is out, will it be required to have the vaccine in order to continue to be an on-campus student at Norfolk State? I think that I can answer that question. Ms. Armstrong, feel free to chime in. We're a state institution, so I think that that would really depend on our governor and state mandates. For vaccines, there are certain vaccines that are required. However, there are also ways that you can be exempt based on religious exemptions and whatnot. And so at this point, that answer would be no, but you know, going forward in the future, it really depends on what's mandated for educational entities in Virginia. Would you agree with that, Ms. Armstrong?
Yes, I would agree with that, as far as, because the criteria would have to be established as to what would constitute an exemption from a legal perspective versus a non-exemption. We see that those same issues also, you know, come forth, or we encounter them in the, you know, K through 12 grades as well, with, you know, parents deciding for students, their children, to not be vaccinated and still would like them to come to, you know, school. So I think that we're going to have to wait for those criteria once the vaccine is actually developed, and the criteria that will be set forth. And I'm certain that Norfolk State, as well as all the other public institutions or state institutions, with the leadership would be following the guidance that would be set forth in the best health and safety of everyone in the community, as far as the higher ed community.
And Ms. Nelson, do you know if there's any conversation about mandating the COVID-19 vaccine once it's past the trials process?
I am not aware of any, I know that there are conversations that are being had about the practicality of that and the legality of such a mandate, but to my knowledge, it's not the position of the health department or the position of the Governor Northam's administration that a vaccine be mandated. That is not the position at this time.
Okay.
Yeah,
Okay.
can I speak to this as well?
Yes.
I actually spoke to the House committee because they proposed a religious exemption, and I did speak on behalf of my patient base. Very concerned because we have so many vaccine injuries, and so there's a lot of concern just publicly about the safety and efficacy of, you know, a rust vaccine, et cetera. They tabled the religious exemption, so it has not been brought back up at this time. And I think a lot of it has to do with just with, you know, you can only skin so many cats at once. Sorry for the vegans out there, but you know, we got a lot going on all at once. We have an election happening. I think everybody really, if we can just kind of slow down, pump the brakes. I think everybody is like 25 steps ahead, and, you know, in legislation and in public health policy, they just do not happen quickly. You have a lot of different factors. So I think if everybody can just take a deep breath and chill, and we'll get there eventually.
Okay. All right. Let's see. The career engineer, I'm sorry, Alita asked, what percentage of patients that are hospitalized die from COVID-19?
I wanted to direct everyone, perhaps I can put this information in the chat or we can share it. We do have our Virginia, the VDH website shares information both statewide and also down to the health district. So you can see specifically in Norfolk how many hospitalizations have there been and how many deaths there have been. And across the state, there have been about a 2% death rate. There have been 2,697 individuals who have unfortunately passed away from COVID-19 across the state. And in Norfolk, there's about a 1% death rate where you have 60 individuals passing away out of the 4,500 approximate cases that are there.
Wow. Yes, you can share it, that information. You should have sharing capability, or you can drop it in the chat. The career engineer wants to know, are self-administered viral tests as valid as hospital administered tests? That's a question for anybody.
That's such a variable question. Who's the supplier? I mean, there's not a, I mean, right now, from what I've seen, and correct me if I'm right or wrong, Sable, but I've seen as low as 30% accuracy all the way up to 98% accuracy. So, I mean, usually it's a 2-year turnaround to validate a test. So again, I think we're, in public health, we're trying to do the very best we can as quickly as possible, but there are certain steps that have to be put in place for things for us to say confidently yes or no or maybe so. And it's challenging because I think the public, again, they want that definitive, rest easy, et cetera, but it's not as clear cut and dry as that.
I couldn't have said it any better myself.
With that.
Okay, anonymous attendee says, are the statistics from the total number of cases on campus going to be shared to the public? If so, when should we expect those numbers? Dean Marable, are you on? So I'm not sure. I do know that what I can tell you, because we handle quarantine housing, is very, very, very low. We don't have an issue, and we truly need for students to continue wearing their masks, washing their hands, using hand sanitizer, staying at least 6 feet apart, especially when you're walking on campus. Students, you're being very good at wearing your mask, but sometimes we see you all walking side by side, and you need to remember to be at least 6 feet apart. And so, you know, what I can say is we'll find out that answer, but what I can tell you is that so far our numbers are very, very, very low. And I would think, you know, some campuses are experiencing 3%, 5%, some as high as 10% of the student population, and they're closing down. We're not having that issue, but again, that would mean we have to continue doing the things that we're doing at Norfolk State. If you don't want to go home, help us help you be able to stay here. Most of the food on campus is unhealthy, leaving students no choice but to eat unhealthy. Can the school provide better access to healthier food? I will share that with Thompson Hospitality. I know that they have a vegan menu and a vegetarian menu, but a lot of the food is truly stuff that we normally eat. And when you listen to Dr. Steele, and you know, I cringed at the no sugar, no potatoes, no bread, no pasta.
I'll be happy to
And I
advise
honestly thought, gee, that's what I ate today for lunch in the cafe. So, you know, I'm definitely going to follow up with them on that. And I'm just going to have to try. You're working with me. I'm a work in process. That's all I say. And so for the student that wrote that, Ms. Sims, we definitely will follow up with them on that and have that discussion. So thank you for that question.
Dr. Fitzgerald, I'd like to just share a transparent moment since we're talking about even in the CAF and not being privy to the line for the vegan, you know, vegan meal and the regular line. And I was actually on one occasion standing on the, you know, the vegan side. And the student even brought it to my attention. Oh, you know, Restaurant Strong, that's the vegan line. I was like, what? Because it really, you know, appeared to be one and the same. It didn't appear to be, you know, anything like different per se. As far as, you know, the menu or how, you know, sometimes we go by how food looks or how it appeared to be one and the same. So I can appreciate the student's perspective from that vantage point.
Yeah, and we'll have that conversation. They have gotten better, but there's still a long way to go. And sometimes it's only 2 or 3 things. And then, you know, what they're preparing for people who are trying to eat healthier and trying to transition. I understand how that can be a challenge. And we've had some students raise that. They do have a committee for students to serve on to help them talk about healthy food choices and things that they'd like to see. So I would encourage any of the students out there to contact Anthony Giles in the cafeteria. He would love to hear your input and how they can make your services better. I will say that they are very open to that, and customer service is phenomenal from Thompson Hospitality. Thank you to the person who said I'm doing a great job. I'm very nervous, but we only have a few more minutes left. The next question is from Davin Williams. What is the best kind of mask to wear for protection? Anyone on the committee can answer. So I'm guessing they mean N95, the cloth. Is it safe, not safe? The hospital kind? Like what's the best kind?
So I think you're asking people that deal in the world of data to verify something that has no data. So that's why we're like, do your best.
So the non-health people, we want to feel good. We want the answers that'll make us, you know, feel like we can go to sleep. I'm protected. COVID is not coming. You know, this mask is it. And I understand. I guess we all have to get it. Okay, I hear you. I hear you.
I will say or interject though that they do recommend saving the N95 mask for healthcare providers, particularly that are in direct contact with patients in the clinical setting.
Yeah,
that is a recommendation from the CDC.
Yeah.
Okay.
Yeah.
So,
and I would say to add, if you are gonna, well, hopefully you are wearing a mask, but when you wear a mask, okay, please not touch your face with the mask. Don't wear it above, or excuse me, below your nose.
right? Don't pull it down here. Don't take it off, put it in your pocket and then break. I've even seen people wearing it, like hanging it on their visor, right? And then so the mask is there to protect you against various different microorganisms, right? It's usually a one-time use kind of phenomena. You either want to wash it in between use or get a disposable one. And also please make it in the trash can. We got rid of straws, now we have masks. You know, our environment, please, let's think about everything, not just one thing. So.
Thank you. Okay. Do you all think that COVID actually started from a bat? This is from Anonymous. Any takers? Okay, the health people are silent. Okay, we got it. Dana wants to know, will all older people and people with serious illnesses get really sick or die from COVID? What determines, I guess, who gets really sick and who dies? If you're older, we hear older people and people with serious illnesses are at more risk. Why is that the case? And does that mean if you have diabetes and you get COVID, there's no chance for you? Or is it just a combination of things that happen?
Combination.
Yes, I would think multivariant.
Yeah, exactly.
What I would say.
And cardiometabolic, anything with the heart, respiratory system, that sort of thing. Now, you know, diabetes is a metabolic condition, so that's going to, again, inhibit the immune system. But I mean, smoke, I can't even stress enough. If you smoke, please stop smoking. Please figure it out. You know, there's tons of programs and offerings that help, you know, because that just weakens that whole area of the system. So, I mean, any kind of lifestyle related, but definitely I would say cardiometabolic conditions, you know, hypertension, diabetes, those kinds of things. You know, I think that just the weaker, the more inhibited the system is, you know, the more susceptible it is to any type of infection, not just, you know, COVID-19.
Okay. Okay. Do you all think that COVID-19 will decrease in the spring?
I left my crystal ball home.
I mean, I hope so. I am prayerful. I'm hoping so, but that's the best we can do. Like, we're still like, because this is a novel, like, I think that we also need to explain or like reiterate that this is like a brand new, this is a novel coronavirus. This is brand new to the scene. We know more than we knew at the beginning of the year, but there's still so much that we don't know. So we could make educated guesses, but that's what they would be right now, just because we don't have the data to support that kind of answer, or that kind of, yeah, to give that kind of answer.
Okay, I understand. Thank you for that. Okay, I'm looking. All right. Ms. Wright wants to know, can you explain, and it looks like we're winding down, we're almost done, ladies. Can you explain the importance of washing cloth masks for students and faculty members and avoiding the reuse of dirty masks, especially when disposable masks aren't available?
I think that Dr. Steele did a really good job of summarizing this earlier, just in terms of the masks. They're there as a barrier. So if you keep taking them on or off, or you're not wearing them properly, or like you're allowing more opportunities for microbes to grow and for the mask to ultimately be not effective for its intended job. So that's the case for not reusing disposable masks. That's the case for washing masks in between use, because we want to make sure that if you're going to go that and do that self-protective step, that you're actually protecting yourself and not putting yourself in more danger by reusing a mask that may be soiled.
Okay.
Because if we just keep in mind as well that the mask is close to our face, so whatever microorganisms are on the mask, we can inhale those microorganisms from a respiratory context. And then it gets into our system and puts us at increased risk there again to be immunocompromised.
Okay. Okay, the next question, if you don't mind, we'll ask two more questions. We're down to the wire at about 7:59. Approximately how long does the virus live on a surface if touched by an infected person?
I think the WHO came out and they said that it didn't live on surfaces, but I don't remember. It's been a long year.
And if an infected person sneezes, how long does it live in the air?
We don't have, I don't think we have any data. Do we have any data on that?
The data. There's speculation, but I haven't seen no hard data about it.
I don't. I've never seen anything. Mm-mm.
Our last question, ladies, and thank you all so much for your time. This has been an amazing learning moment for me and hopefully our audience as well. What are the chances that somebody who has tested positive and has been cleared are likely to test positive for a second time?
Oh, so when they say cleared, what is that? What do they mean by that?
They tested positive, and then I guess going through the 10-day period, maybe they took another test and they were negative.
They were
So
negative.
what is the likelihood of them contracting COVID again?
I mean, I don't know. There's no hard, is there any hard data on any of that? No, I don't know. There's speculation again, but there's nothing to definitively say. I think it's important for, again, the students to realize, right? Like we're healthcare professionals and leaders, right? And so as leaders, we want to actually give you the proper information, and we don't want to go off of speculation. So I know you guys want to be reassured, right? And so from a reassurance perspective, the immune system is strong. It can heal itself. You do the things that you can do to heal yourself. The rest of all the creative thinking, I love creative thinkers. I think we can go channel that into something else other than trying to think about the 100 ways that we could get COVID. We could I don't know, like build stuff and paint stuff and play stuff. Let's do some of that.
Thank you.
And in closing, when we talk about being health professionals and wanting to put the accurate information out there to the students, after quarantine, the patients should have 2 negative tests before being cleared, not the one. And the quarantine in general is 14 days.
Thank you so much.
Versus 10.
Okay.
Okay, I'd like to thank all faculty, staff, and students for joining us this evening. Be sure to take your mandatory COVID-19 training by September 22nd. Excellent job to all of the panelists and the moderators. Virtual hug is extended to you. Please join us on tomorrow for our next session, How to De-escalate Tense Interactions. Have a nice evening, and thank you so much for joining us, and we'll see you tomorrow.
Thank you, sisters.
Bye-bye.
Take care. Be blessed.